Hi guys, welcome back to Dr. Shane's channel. Today I want to tell you guys a little bit about what's it like in a typical day as a doctor in Jamaica at Kingston Public Hospital. And that your day varies because you don't always know what you're getting when you go to work. So yes, there are days and then you have different areas. So it depends on the areas that you work in, all right? So I work in the surgical aspect. Other people work on other surgical firms. You have medical wards. You have accident and emergency area, which I've had a feel of all the areas. But your day really depends on the area that you're working in for the day and what that entails. And because patients are so unpredictable as well. So on a regular day, if it's a day in which the firm that I'm on is not admitting whatsoever, and then usually we have stable patients during that time, and it's usually a day to just go in there, see those patients for the day, ensure that they are stable, their vitals are fine, there is no major issues going on with them. If there's any major issues that are coming, you attend to them to get them sorted out, checking that the blood tests are okay. And it's what we call a SOAP, which is a short summary for the day of what's happening with the patient, looking at the critical areas, and then from there moving on to the next patient. Do what we need to do for that patient for the day and moving on to the next patient. If it's a day when the team that you're on is admitting patients for the day, then your day is a bit more complicated because you don't know what is going to happen. Anything can walk or drive or come into the hospital, and your day can go from 0 to 100 in the blink of an eye. It can be a smooth day going. You could be on your last patient of your regular stable patients for the day, and you get a call that there is an emergency in the accident and emergency unit, and you have to go down there to sort out this patient, whether it is GSWs to the body, to the head, whether it is whatever the case may be. Stop what you're doing depending on what the A&E doctors report to you of how critical the patient is. Rush down there, sort out the patient, ensure they get their CT scans that are needed done, if you have the time for that, or if you have to just rush them into surgery to get surgery done. And then it varies because so that's your regular day if you're on the ward setting or in a surgical area. If you have if you're on a general surgery special area, then you know you have all your patients for the day, along with whatever surgeries that you have to try and get done for that day, along with teaching your junior staff anything that they need to do, don't need to do, how to help them whatever processes they may need. So your day varies depending on whether you're on call admitting that day, not on call admitting that day, and the workload that you have in terms of your patients. In the A&E unit, as far as I know, anything can walk in at any point in time, and you just have to be ready to go. The good thing is that in the A&E area, they divide, it's set up into different areas based on the triage system that we use and based on how urgent or critical that patient is for them to be seen. Most times, like for us on the surgical areas, most times if it's a critical patient that comes in and needs to rush into surgery, then we usually don't have the time to wait on the blood tests that they need to get to see what's going on, or to do the scans or anything, especially if it's like a severe traumatic complication, or if a patient was in a motor vehicle accident, or the person got multiple gunshot wounds and we need to rush them into theater. Then we usually have to alert the ANES staff, and from there have a quick discussion with everybody and rush them into surgery as quick as possible, get blood products if we need it on board, and proceed as urgently as we possibly can. So I would say that a day in the hospital is variable. I would say it can go from 0 to 100, as I said before, and it really just depends on whether it is that you're on call that day or not on call that day. Because when you're on call for 24 hours. Your team is on with you for 24 hours, and so whatever comes in that needs your specialty opinion on, you will be called about. And so your day will vary a lot. You can a lot on those days. But for the days when you're just not on call, your days can be more relaxed because you know the patients that you have, you know the patients that are already yours, and what you have to deal with for those patients already for the day. The periods that you work are different. So a team of you are on call each day. What we usually do is that we split it amongst ourselves of who is covering where during that time. But the whole team is on for 24 hours. So from 8 in the morning to 8 the following morning, which is whenever the team is on call. That's your 24-hour shift. And then we split as to who covers where during that time so that we don't have burnout. And then once the 8 o'clock in the morning comes back and that 24 hours finished, you still have your regular 8 to 4 hours of work, which we still separate as a team so everybody not burned out and we work as best and as efficient as we can. So although we also have 24-hour shifts when you're on call, there are times when the day is going extremely rough. There are times when patients just keep coming and coming and coming and coming, and you're like, what is happening today? There are times when you have to go in and probably do 2 or 3 surgeries for the day just because of what's happening, and sometimes you don't even get adequate rest that you want. So yes, there have been 1 or 2 times when I have gone straight 24 hours with probably maybe an hour or 2 hours of sleep. Because of the amount of patients that we have had, because of the emergencies that come in, because of the emergency surgeries that we have had to do. So there are days when everything goes haywire. There are days when your 24-hour duty shift is horrible. But there are other days when it's cool. There are other days when it's chill. There are other days when you don't have that hectic up and down bus where you get a good amount of rest and your team gets a good amount of rest with you as well. So I say it just depends on, it's unpredictable, but it really just depends on how well your day goes that day. So your typical day can depend on what's happening. So if you're a doctor who works in the accident and emergency area, it depends on what area you're working in the accident and emergency area. Are you in a level 1 area or in a level 4 area? A level 4, 3 and 4 area is similar to almost like a clinic. You can see anywhere from 8 to 15 patients, plus or minus, depending on what's going on with those patients, because those patients aren't necessary that aren't critical patients. If you're in a higher level where there's more emergencies that come in, it really just depends on what comes in. So you could have patients who are at risk of getting heart attacks or stuff, or those critical type illnesses will be more in a level 1 area that you'd want to attend to quicker. For patients who just come right in from gunshot wounds or being involved in collision accidents, then you have to attend to them extremely quickly. Stop whatever you're doing with the patient that you're seeing once they're not critical and attend to those patients immediately. So it just depends. If you're in you may see less patients that day, but it just depends on what comes in if you're in a more critical area, more level 1 area. For the surgical aspect, how many patients you see a day really just depends on how many patients you have admitted to your team or to your firm. So if you have 10 patients admitted to your firm currently, then you have 10 patients to see. If you're on call that day, then whatever other patients you get called about, then you also have to see those patients. If you're not on call on that day and it's just 8 or 10 patients you have on your firm at that point, then you just have the 8 or 10 patients to see for the day and attend to them, whatever the needs be for those patients for the day. Well, thank you guys for joining my channel again. I look forward to putting up more videos for you, and you guys can also let me know what you want to hear more about as well. Have a great day.